This week on Healthy Living, we explore the burden of viral diseases. African virologists gather in Abuja to explore solutions for managing emerging and ongoing viral threats. And how does your bowel movement frequency affect your health overall? The answer coming up. Plus, rising cancer rates challenge Kenya's healthcare system. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Lina Khmoudou. Thank you for joining us for another edition of Healthy Living. Viral infections are a source of concern worldwide. According to reports by the World Health Organization, emerging infections such as COVID-19 are becoming increasingly frequent, while continuous challenges such as HIV and hepatitis remain prevalent, particularly in low and middle income countries. Urbanization, climate change, and international travel are partly to blame. Virologists from across Africa met recently in the Nigerian capital, Abuja, to hold talks and explore groundbreaking research and solutions to help the continent cope with emerging and re-emerging viral threats. Africa depends heavily on foreign aid to respond to disease outbreaks, but the African virologists say that could change soon. Timothée Obiezu has this report from Abuja.
With two major viral outbreaks, Marburg and Mpox, in Africa this year, the stakes at this three-day African virology conference couldn't be higher. But homegrown solutions to viruses and their outbreaks in Africa are at the heart of the dialogue.
Well, we have neglected tropical diseases, a number of viruses which are important and they emanate from the African continent. We find that the attention of the Western countries are not so much focused as we expect. Normally they say Africa is resource constrained or resource limited, but now we have realized that those tags are not really true. We have a lot of resources and we can harness our own internal resources.
It is the second summit of the African Virologists Network, AVN, since its launch in 2019. The aim to provide a unified platform for African virologists to collaborate, showcase their research, and address common problems. The conference also seeks to promote Africa's groundbreaking solutions in virology, including vaccine development to global health.
In this conference, we have quite a number of presenters who are Africans working in America, in European laboratories among us now. So African virologists are contributing a lot to the global effort. We are training many young virologists to take up the field. So in the near future, we shall be producing our own vaccine and even exporting to other countries abroad.
Attendees see the conference as timely as many African countries often struggle to respond to disease outbreaks due to limited resources, poor health systems, dependence on international aid, and global vaccine inequity. Experts say climate change and raging conflicts have exacerbated disease spread and sometimes hinder response efforts. In 2024, Africa recorded over 34,000 confirmed and suspected cases of Mpox, with over 850 deaths. Professor of Virology Adewale Tomori says Africa must leverage on disease prevention rather than control.
The summit, obviously, it is very crucial for Africa. Africa at the present moment is at the begging point. The world comes to us very late after the epidemic has gone all over the place. And I think it's in our role as virologists, actually, our focus should be on prevention rather than on controlling those epidemics.
Adiku says African virologists are working to develop vaccines that are sourced from local biological materials like insects and can adapt to Africa's climate. According to Adiku, with more government and private sector funding for research, Africa will have a safer future. Timothée Obiezu, VOA News, Abuja, Nigeria.
what virus are you most concerned about right now, and what more should be done to prevent the spread of viruses in your community? Here are some reactions from the DRC.
The epidemic that worries me a lot now is Mpox, because it's highly contagious, and if it continues with this intensity in our entity, it's likely to wipe us out. To protect myself, I follow the advice of health professionals. I respect the barrier measures, and when we are asked to be vaccinated, I won't hesitate to protect myself. The health authorities need to increase the number of vaccinations, step up public awareness campaigns, and make batches of condoms available, because the disease is also transmitted rapidly by sexual intercourse.
Sanitation is a challenge in many households, which is why cholera is springing up in the town. There are many places where rainwater stagnates. There are hardly any dustbins left in the plots. The population density is becoming too high. We are drinking water from the lake, which is sometimes not as available from the taps. In short, the population is exposed to the cholera epidemic that authorities do not know how to control. However, if the government managed to put an end to the war so that all the people concentrated in the sites for the displaced could return to their villages, the city would be cleared and multiple epidemics could be prevented.
I have noticed that the spread of cholera depends on the negligence of the population. We hardly respect hygiene measures, and if you go to the displaced persons camps, you'll see that people are crammed into small shacks, and that doesn't save them from contamination. To protect myself from this epidemic, I do my best to always respect hygiene measures, such as washing my hands every time after washing or before eating.
When there's a lot of dust in the air and people are supposed to breathe it, it causes flu. But this epidemic is becoming worrying in Goma because there are houses under construction almost everywhere. In every avenue, there are houses under construction, and when the wind blows, dust comes out. Residents are also throwing leftover building materials like cement all over the place, and that's why flu is becoming an epidemic now. To protect myself from flu, I try to keep clean and well covered. The authorities need to build drinking fountains all over the place and connect water to our plots, because we must be scrupulous about hygiene.
Cholera is becoming a threat in the town because of the difficulties in observing hygiene measures. We have no water to keep our children clean after using the toilet, and they often eat without even washing their hands, which is why they have cholera.
Dr. Zewdu Hurissa is an internist and tropical and infectious disease specialist from Ethiopia, Arsi University. He discusses unique environmental, social, and economic factors that contribute to the spread and impact of viral diseases.
We have seen over 30 different viral infections that has re-emerged over the last couple of decades. Yeah, the first thing is awareness creation. Because of an increased population, so the agricultural impact is also huge. Livestock, interaction with the livestock, in interaction with the wild animals, from which we get the infection. So awareness in the first place. And the second is surveillance method. There has to be a strong surveillance method, which basically has to be supported by, through with North-South collaboration, because this will require some degree of skill transfer and also technologies. And the other is preventive methods, prevention. One is investing in vaccine development, drugs, improving the quality of life, including sanitation, education, malnutrition, which suppresses the immunity and contributes for the severe illnesses in general. This is not in particular for viral infection as well. So it works for the other infectious diseases. And the other is the improving the number of healthcare workers.
Now, everybody poops, but does it really matter how often? The answer is yes, according to a study published in the scientific journal Cell Reports Medicine. Scientists analyzed data from over 1,400 healthy adults and found that constipation was linked to higher levels of toxins like p-cresol sulfate, which strain the kidneys, while diarrhea was associated with liver inflammation due to excessive bile acid loss. Younger people, women, and those with lower body mass indexes had less frequent bowel movements. According to the researchers, irregular bowel movements, such as constipation or diarrhea, have been associated with increased risks of infections and neurodegenerative conditions. Experts recommend healthy habits such as eating fruits and vegetables, staying hydrated, and exercise regularly for a healthy bowel movement. Cancer is rapidly becoming one of the leading causes of death in Kenya, with the country's population facing cancer diagnosis at an alarming rate. Yet, despite advancements in medical treatment, treatments are hindered by two powerful obstacles: stigma and poverty. Take a look.
Speranza Minor initially found herself in denial after being diagnosed with breast cancer. For months, she kept her diagnosis a secret from her family, delaying essential treatment. But the emotional burden was only part of her struggle.
So where you didn't get the money from? You can go to people, sometimes even you call people, they don't even pick your calls.
Each round of chemotherapy costs 35,000 Kenyan shillings, over $280, which is too expensive for many patients in Kenya. According to a recent World Bank report, most cancer cases are diagnosed at advanced stages, leaving families with few treatment options and often pushing them into crippling debts. Stigma makes the problem worse.
There is a lot of stigma associated with cancer of the cervix, the female reproductive system, a bit taboo. So what tends to happen, a lot of these women have early symptoms of the disease, but fear coming out to have them attended to. Or alternatively, yes, they know there's something off, but then they think in terms of, if I go speaking to my husband, for example, who's the one who's meant to take me to hospital, I'll be replaced.
Government data show that cancer diagnoses in Kenya are on the rise, with an alarming 30% increase in annual cases between 2012 and 2018. The Health Ministry attributes the spike to improved life expectancy and the growing prevalence of unhealthy lifestyle choices such as lack of physical exercise, alcohol abuse and smoking. Despite the challenges, Speranza remains hopeful. She has found support in the form of Muthoni Minor, a fellow survivor who has launched what she calls a cancer cafe. It is a safe space for patients to talk and find support.
90% of the population is either affected by cancer, know somebody who has cancer, or has it themselves. So that's literally a very big chunk of the population for us not to have that conversation. So the fact that now it's a conversation that is being had over and over again is going to get rid of the stigma.
Muthoni believes that fostering open dialogue in communities is essential for raising awareness about breast and cervical cancer, particularly in areas where stigma still prevails.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.